And I think that's what I'd like to see change the most about healthcare is we have the power. We have some very large entities that really control product pricing and data in the U.S. healthcare system. And I'd like to see some of these entities enforce a more ethical sourcing strategy with some of these suppliers, making it difficult for them to get their products into the market if they violate these types of standards.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite, and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
On this episode of Power Supply, we will speak with Ann McWhorter, VP of Business Development at Meperia. We're going to be talking about country of origin, but it's not the conversation you've been having. It's a lot broader. It's beyond the finances, Hayes.
She will do a great job in highlighting some things that we have not thought about, including ethical concerns. So stick around, come on and listen.
Yeah, this is a course in ethics. Stay with us. We'll be right back after a short break.
I'm Hayes Walder.
This is Gary Skinner.
And I'm Justin Poulin.
From the studios of Healthcare HQ, you're listening to Power Supply.
Joining us now is Ann McWhorter, VP of Business Development at Meperia, and we're going to be talking about tariffs, but it's not the tariffs conversation that you've been having. We're going to go a little bit deeper into this conversation and talk about why country of origin is important. And again, it may not be why you think. So Ann, welcome to the podcast. I know you were previously on the ARM podcast, so we've gotten a chance to get to know each other, but you're really going to get a flavor for Hayes today.
Thank you. Thank you both for having me. I'm really excited to be here. Country of origin definitely became the topic in 2025 with the tariffs, of course, and I'm glad we're going to shine a light on it today. Thank you for having me.
Yeah, I'm excited to hear about it, honestly, Ann, to learn a little bit more about it. I mean, and in fact, a couple of weeks, I have my supply chain meeting here in Nashville, and I'm sure this will be a hot topic for sure.
Well, we're getting prepped up. This is going to be the first time I'm going to be at that meeting with you, Hayes.
Oh, that's right. Yes. JP is going to be in rare form, I'm sure. So we're happy to have you.
I'll be making an appearance anyway. So, all right. Well, Ann, yeah, if you want me to. All right, Ann, let's talk about how you found your way into healthcare supply chain. I've heard your story, but I really want the Power Supply audience to hear it too.
Of course. I stumbled into it entirely. Right out of college, I answered an ad in the Raleigh News and Observer and ended up working for a med-surg distributor. And that was sort of the beginning of my healthcare supply chain career. I stayed because I realized how much impact supply chain has on patient care. My background is healthcare data and EDI automation, but I saw very early on in my career all the breakpoints in the healthcare supply chain, especially as it relates to data. And, if the foundation is wrong, whether it be part number, billing codes, recall, or country of origin, everything downstream fails. Purchasing, billing, compliance. So I have spent my career helping people repair those data breakpoints. It's always challenging and never boring, I should say.
And particularly nowadays, I think it's probably, it's not nearly as boring as it might have been in the past.
That's right. Sure. That's right.
Yeah, it's almost too exciting. So
Exactly.
let's talk about shortages as we it's a big tee up to the conversation. Everybody's been dealing with it, and I think a brief history over the last many years. Like let's dive into that. Give us some context, and then we can really get into the country of origin details.
I think supply chain people have been chasing shortages, especially since 2020, since COVID hit. And I think even last year we were all very affected by some major shortages, like with Baxter IV and the hurricane that happened in North Carolina. In 2025, it looks like it's gloves, it's drugs, and it's syringes. And before we sort of published this information, hospitals really didn't know where these products were coming from. You're right, our last session on functional equivalents actually pairs well with today's session, because when shortages occur for any reason, hospitals need a lens into every manufacturer in the market that's making that specific product. But they also need additional information. They need country of origin. They need recall information, recall history. They need environmental data. So in addition to having a good source for unbiased functional equivalence as it relates to shortages, they've got to have all this other information that's very pertinent to the operation of their supply chain. This is sort of the holy grail of supply chain data, and it supports that resilient supply chain model. You can probably hear I've got a friend in the background.
I'm giggling because of it.
He only does that when I'm on a call.
Of course.
But this is definitely the holy grail of supply chain data, and it supports that supply chain data model. Having functional equivalents, unbiased functional equivalents, country of origin, recall history, high, low, and average industry pricing, environmental data like disposability and chemical attributes. Hospitals need all of this information to effectively navigate back orders.
Well, can I ask a quick question about the country of origin? Can you kind of explain that to me? Because you have raw materials that are coming from certain areas. They're being literally put together in certain countries. So if something was put together in the Philippines through raw materials in 5 or 10 other different locations, what is the country of origin there? And kind of explain some of that.
Yeah, country of origin is incredibly complicated. Beyond cost, it really reveals, where the product's made and also by whom. And, everyone has a stake in it. I will say that GPOs, distributors, and the manufacturers all have a stake in providing this information. Over the summer, I attended the American Hospital Association Sustainability Conference in Nashville, Tennessee. And that's a mouthful to say, but it made me realize what country of origin really shows us. There was a study published in 2024 by the National Library of Medicine, and it stated that 50 to 60% of products purchased by U.S. hospitals come from countries rated as high risk for labor rights abuses. And what that means, and I had to really do some research on this, that means forced labor, child labor, unsafe conditions, and wage exploitation. And that same study also stated that about 70% of manufacturers provide this data. 70% is probably generous. And those that don't, we've got to question why. But it's hard to get your hands around country of origin, especially when these products, packs and trays, for instance, are being assembled in various parts of the world.
And there's really no requirements, right? Like how you determine that. It's not like a sophisticated structure for reporting country of origin or any guidelines requiring that they do it.
That's right. And I think that's where the confusion comes in, when we don't create standards and enforce them. We leave it up to the manufacturers and the GPOs and the distributors to sort of provide this information. And in that way, it can very much protect, revenue sources. I think with the numbers that I've seen in researching this, it's a very high number of products that are being made in places where, the plants may be unsafe, and certainly conditions are unsafe. And that's the piece of the puzzle that we've really got to address. I was on a call with a children's hospital recently, and they want to make sure, of course, that they're not buying product from countries where child labor exists. We should all follow their lead. When I started doing research for them, I found that there were 3 high-risk categories for this: gloves, surgical equipment, and electronic devices. And the surgical equipment was examples like scalpels and forceps and retractors, hemostats, staplers, things of that nature. And then as it relates to electronic devices, it was pulse oximeters, blood pressure monitors, ultrasound machines. There are certain high-risk categories that we see where, a great majority of that is being produced in countries that we question their labor practices.
All right. Leanne, you bring up some really, very important points. And I sit here and trying to think about this. Are the name brand, without naming names, are our name brand manufacturers in the United States doing some of this, or are the OEM partners that they're using doing some of these, poor practices, if you will?
It's probably a little bit of both, but in my research, it's definitely the name brand manufacturers that are on contract today here in the U.S. Without naming names, I'll be as diplomatic as I can about it. But there are some very large manufacturers that provide, especially around surgical gloves, that have been questioned, that have multiple court cases pending at the moment for just that. And in the U.S., we don't seem to penalize manufacturers for poor performance, for this type of risky behavior, for recalls. And I think that's what I'd like to see change the most about healthcare is we have the power. We have some very large entities that really control product pricing and data in the U.S. healthcare system. And I'd like to see some of these entities enforce a more ethical sourcing strategy with some of these suppliers, making it difficult for them to get their products into the market if they violate these types of standards.
Obviously country of origin plays into supply chain resiliency. You're talking about having that transparency. It ties to shortages. Shortages ties to just, that sustainable, process. But sustainability has always been narrow that way, and now it's this broad term. What I really like about how you're changing sustainability in its old term, instead of making it mean like supply chain resiliency and all that, you're saying sustainability also has to do with country of origin and ethical practices. So it's sort of like we're broadening it, the idea of sustainability, but I think more towards those ethical lines, which is a very interesting kind of adjustment to that term and how it's been used and what we've been seeing over the last 5 years.
Yeah. And I went to that sustainability conference in Nashville with that in mind, really thinking, okay, this is about disposability and, recyclable products. And, I had that same sort of mindset. And as I sat and listened to Rob Califf, head of the FDA, it really is about where these products are being sourced, if they're safe, if they're being produced in safe and clean environments, who is making these products. And as we start to look at some of these manufacturers that are, have a huge footprint in the U.S., we've really got to ask where they're making these products and who is actually putting together these surgical instruments, who's creating the products, and, are we paying them fairly? What type of manufacturing regulations do they have?
All right. Yeah. I'm Tommy from Tupelo, and I work at the health system there, and I'm trying to do some sourcing and contracting. How do I know? Where do I go look? Where are these standards? How would I even begin to know? And what questions should I ask a supplier or manufacturer in order to get some of this detail?
That's a great question. As I mentioned, it's fairly complicated to get this information. I've heard that about 70% of the manufacturers in the country do provide it. There is some data. We do a lot of scraping from .gov sites and OSHA and things like that. Your manufacturers, your distributors, and your GPOs should be providing this information. if you cannot get this type of information, there's a couple of things that I think hospitals could really do to help enforce this. And one is obviously insert this language into your contracts with your distributors, GPOs. Make it a requirement. I think that it is no longer a nice to have. It's a must have. And I think we need to put more pressure on GPOs and distributors to provide this information, because ultimately they're the bridge between hospitals and that relationship with the manufacturer. I think I've always questioned if it's not available, why? I know it's complicated. That's usually the answer, but it's not that complicated. So, we can't protect revenue streams that are unethical in the U.S. We just simply can't. And I think that's, as we sort of, open this discussion up a little bit further in the coming years, I think it will become really important. Like I mentioned with that children's hospital system, people want to know that they're buying products from good places and with that support ethical sourcing, that are made in clean environments, sterile environments, and that have the right safety regulations wrapped around the product.
Yeah, GMP, just basic good manufacturing practices.
That's right.
But I mean, I totally get, the country of origin. That's one thing. And I think that's really become top of mind. That's, I think, virtually every supply. Tommy in Tupelo has been asking that question for 4 or 5 years now. But he probably hasn't been asking about the ethical standards, right? And so to me, if a manufacturer is not doing a good job there, they're not going to be very forthright in saying, oh, yeah, we hire, So then my point is we need like a third party to kind of verify some of this stuff, because a true manufacturer is not going to, confess to like, yeah, we use terrible practices and wherever we are.
That's right. Almost like an ethical sourcing committee. That really sort of, I've thought about that as well. I thought some sort of ethical sourcing committee that really looks at the major players in the U.S. and where their products are being made and who's really propping them up and supporting them. Because what ultimately we want to do is change buying patterns, right? So if we can make this data available, we can change buying patterns and really force manufacturers into more ethical practices. And that is definitely the goal. But we've got to put some pressure on the GPOs to take a hard stand on ethical sourcing. That is, they play such a strategic role in what we buy and where we get it. And so as a player in this industry, there is a responsibility to the community and the public to provide this information.
While ethical standards and national security considerations might not seem that overlapping, I have a suspicion they're a lot more overlapping than we might think, right? Because it is the concerns we have around, over-reliance on, geopolitical rivals, and just the politics of some of this probably are also the concern isn't the ethical piece, but I think the concerns over ethics are probably central to both of these scenarios. It's like, ethically, can we continue to rely on our geopolitical rivals? Because that gives them influence over, the decisions that we make in our own country. And, I had a really cool interview on the ARM podcast, I want to say 6 or 7 months ago, before a number of things had actually come out in the news as they have recently. But the whole conversation was around, like, a lot of the tech that's coming into the U.S. has malware on it that could disable us. And we continue to buy that. And how do we pull that out of our infrastructure today? And so can you talk about that part of why country of origin is so important as it relates to, like, especially like electronics?
Oh, you bet. I think there are a couple of things to consider, right? First is patient safety. We cannot assess risk if we don't know where a product is coming from. I mentioned earlier, like, if you can't find this information, then there's some suspicion behind that. You mentioned also the geopolitical rivals. I think with the tariffs, we've probably created more rivals than alliances. And if we have our supply chain tied up in a single source country or a single source supplier, we've left ourselves with a vulnerability here. And we've probably created additional failure points. And we saw that very clearly last year with the Baxter IV solution. When one plant went down, the entire country was affected by the shortages with IV solution. So I think we certainly can't single source through one country. We can't single source through one supplier. But to your point, these tariffs have probably created more rivals than alliances, and we can't have an over-reliance on these geopolitical rivals for critical medical supplies. But also, it's really important to consider environmental and ethical standards. Some countries simply have unsafe manufacturing practices, much looser regulations than in the U.S. And I think that's the piece where we've got to start putting pressure on manufacturers and to really understand the labor practices and the conditions that these products are being produced in. I think that's probably one of the most important things that we could do at this time. The data is very fragmented. It's commercialized. Hayes, you asked earlier, why is it that we can't get our hands on this? Everyone owns a piece of it. It's manufacturers, distributors, and GPOs all own a piece of this information. But if hospitals can't get that picture, then they don't have transparency. And if transparency is optional, we've created a perfect environment for confusion. And confusion can hide a lot of things. It can hide unsafe chemicals. It can hide unethical production of products. It can hide environmental. It can hide anything. Hazards. Yeah.
if you don't know what's going on, you can hide anything.
It can hide anything. And that really, in all cases, it protects revenue. It does not protect the patient.
You mentioned some good things that hospitals can do, like, start putting requirements in their contract language, right? And placing an emphasis on that. I'm not sure, again, you still got to figure out, you can put it in the contract, but you still got to manage contract compliance. So, the starting point is let's get it written in there, but to actually enforce it and put a team behind making sure that it's being enforced is like another layer. So I'm just kind of thinking, like, we're talking about building momentum here, not flipping a switch or asking the government to just come along and bail us out with this. Like, I understand that, some of those things will never happen, right? And some of those things will take a long time to happen. So maybe give our audience a sense of empowerment on this and say, okay, contract language is one thing. I think you might have mentioned a couple of others, but like, is there anything else that they can really be doing, not only to set the table for the future, but generating momentum today? I think you mentioned like talking to the GPOs and making this a higher priority in their conversations. But just give them something like real actionable. What else?
It comes down to the data. It really does. Let's take it all back to the data, because this data has to live in the materials management system. It has to live in our virtual item masters. We've got to have a hit rate on it. We've got about a 90% hit rate on it now, but that wasn't the case back in February. We have fought tooth and nail to get this information into these item masters so that sourcing committees, cost, quality, outcome, and value analysis, when they're comparing those functional equivalents, they actually have country of origin data there. And our next step is to actually tie it to these high-risk countries. And we're not saying that the product is being made in a plant that has child labor. What we're saying is that this product is coming from a country that is high risk. This category is high risk. And so I think one of the most important things, one of the most actionable things that people can really do is to get this data to live inside their materials management system, inside their item master, so that when value analysis, sourcing, CQO people need to compare like products, they have access to this information. And it's just like any other attribute.
So that could go in the contract language. We require it, and we require it in this format so that we can put it in our MMIS systems. So with that in mind, the health system then, I know we don't really have any big picture sort of risk profiling today, like it's accessible, from a data standpoint. But I do know that there may be some efforts underway currently to start doing some of that risk profiling to understand country of origin. Then you can start building it into your resiliency planning, right? But if you don't have the data in your MMIS, it won't matter if somebody can give you the tool. You still won't be able to apply any practical application to it in your organization, correct?
Yeah, I think that's a fair statement. I think when I think about this, I've been in this for 25 years, and I've seen hospitals leverage their buying power in a way that really pushes initiatives like this forward. And I don't want to underestimate the power a hospital has, because when you put them together, they can change an industry, they can change behavior. And I'll say this just very candidly, the threat of losing business is a very compelling event to manufacturers, distributors, GPOs. So for hospitals, they do have the ability to apply pressure. And that way, we've got to stop buying products from companies that have known human rights violations. That's where we are in this industry. And I think that piece of the puzzle is such an important piece to address, because we're accountable. It's not just a part number or an SKU number that we're buying, right? We're buying the responsibility of the product. And physicians and clinicians, when they use a product that they think is safe, and it turns out that the product came from an unsafe environment or it ends up on recall, it's a reputation risk for them. It's a reputation risk for the hospital. And I think more and more hospitals, like the Children's Hospital I was mentioning earlier, are really starting to pay attention to where these products are being sourced from, because safety, patient safety, is tied into this in a really big way.
So, Leanne, this has been a great conversation. Hopefully you've inspired some folks out there. One thing I do know is it is going to take a collective effort, right? You can't just have one organization leading the charge on this. It's going to take, an effort of many to be able to move the needle. Is there anything else you think we should add before we wrap up the conversation? Anything that you have to maybe even motivate or help people collaborate, towards this effort?
Yeah, thank you, Justin. First of all, I appreciate this conversation. I'll just say this. Transparency isn't radical. It's our responsibility. But like anything else, we really have to fight for it. So I'll leave you with this. When hospitals align and demand change, the industry will listen. We live in a pay-to-play environment, and ethical sourcing will only be driven by hospitals. And I've seen such a passion from some of these hospitals that really want to create a supply chain that is very ethical, very green, very sustainable. So I have a tremendous amount of hope for this topic, because I think the more we can shed light on it, the further we'll get. Sunlight is the best disinfectant. So I'll just say I really appreciate the opportunity to share my viewpoint on this.
Yeah, I like that. Sunlight is the best disinfectant.
Yeah, absolutely. It kills everything. I wonder if maybe you get your major GPO players to maybe find a small group of folks, maybe a team of 8 or 10 that they all fund, and that team literally physically travels to these manufacturing warehouses and documents and those type of things. They come back and now they have a benchmark that all three of the major or whatever, all of the GPOs out there could say, they've been vetted. It's all here. And that seemed like that might make sense.
Hospitals get accredited, right?
Yeah. That's right.
Yeah, manufacturer accreditation, and again, it might have to be. It seems to me like the GPOs could all just fund. Again, I don't think that'd be a massive team to do it, right? And they maybe it's a couple $100,000 a pop. They pop in. These guys and gals fly over literally to to China or wherever, and literally physically lay hands on these products and on the manufacturing facilities, and then they can give you a decent report. Then you would know where you stand.
I think it would give hospitals a great sense of relief. An ethical sourcing committee that really looks at all these manufacturers and how they play in the industry and where these products come from, how they're made, where they're made, who makes them. I think that's a great idea. I mean, it's something that is incredibly needed in the healthcare industry today, for sure.
Well, you've provided a great conversation, Leanne, on this. So I appreciate you hopping on. This is good.
Yeah, thank you. I appreciate you guys. I love this show. I really do listen to it. And you always have the best guests. And supply chain's a complicated process. I think it's a difficult puzzle to solve. We've all been in it for 25 years. It's not getting easier, frankly. So I've learned so much listening to your podcast, and I just hope we can continue and other people can pick up nuggets of information along the way.
Awesome. Thanks,
Awesome.
Leanne. Great
Leanne.
job today. That was Leanne McWhorter, VP of Business Development at Meperia, talking about country of origin, but not just as it ties to tariffs, which is probably the most common conversation we're having. But I really love the fact that she's just bringing the ethics of sourcing to the conversation. And hopefully we can help elevate it to the forefront because it is an important consideration. I know we're all digging in on cost savings, but there are other considerations to make sure that we have in play. And that geopolitical conversation, Hayes, that makes me very nervous.
I totally agree. And she did a really good job highlighting all the different aspects of this, geopolitical, obviously, and as well as the ethical. I think that's something that everybody needs to be aware of.
Yeah. Well, hopefully we'll elevate it, like we said, and get that conversation going. And obviously, if anybody wants to connect with Leanne, you can send us an email to info@powersupplymedia.com. That's our email address. If you want to reach out, you can also connect with us on LinkedIn. And on behalf of Hayes and Gary, who's somewhere in parts unknown, thanks for listening to this episode of Power Supply.
Thank you for listening to this week's episode of Power Supply. As a reminder, you can help support us by subscribing on your favorite podcast app or by downloading the smartphone app on your iPhone or Android. Simply search for Power Supply in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@powersupplymedia.net. We look forward to hearing from you.